Dental Office Emergencies, Case Study Project on Asthmatic Attack by Kristen Henson and assisted by Mariella and Annie. Mariella arrives 15 minutes late for her appointment. She states her schedule has been extremely hectic that day and she is stressed. She apologizes for the inconvenience, but must be seen as she's getting married over the weekend and needs her teeth cleaned. 15 minutes into the cleaning, she begins to cough and an asthmatic attack occurs. The clinician reviews Mariella's health history form. She is healthy, and the only box marked is asthma. Follow-up questions are asked on the frequency and triggers of her asthmatic attacks. The patient states her asthma is controlled and triggered by stress very infrequently. The patient has her inhaler with her, and it is placed on the counter behind the clinician. The patient states she's getting married and has been very stressed with the upcoming events. She apologizes for being 15 minutes late for her appointment. The clinician takes all her vitals, and they're within normal range. Treatment starts, and 15 minutes into the cleaning, the patient begins to cough. She appears to be short of breath, with a slight wheezing noise being heard. The patient is showing signs of an asthmatic attack. The clinician stops treatment and places Mariella into a seated upright position. She instructs her to put her arms forward while remaining calm. The clinician asks a colleague to retrieve the medical kit and oxygen tank. Loose clothes are already worn, so nothing needs to be adjusted. The patient is asked to use her bronchodilator for self-administration and is instructed to breathe slowly through pursed lips. Supplemental oxygen is administered at 4 to 6 liters per minute using a non-rebreather bag. The patient's vitals are monitored. The patient is starting to feel better and symptoms subside. Treatment is then rescheduled for another day after her wedding. What is asthma? Asthma is a chronic respiratory disorder in which there is an increase in responsiveness of the trachea, bronchi, and bronchioles to various triggers, resulting in a narrowing of the airways. It is characterized by recurring episodes of dyspnea, wheezing, coughing, and chest tightness. As you can see in this photo, this is a normal lining of the lung, and then this is one of an asthmatic where it's very tight and swollen and has excess mucus. An allergen is a substance that causes an allergic reaction. The bronchial inflammation in the asthmatic is the result of the body's immune response to an inhaled allergen. Asthma is a complex disease that is influenced by multiple genetic, developmental, and environmental factors. In the dental office setting, stress-induced asthma or an allergic response to the dental materials may result in an asthmatic attack. These triggers are used to classify asthma into 5 groups. The most common is extrinsic, which includes pollen, dust, mold, air pollutant, and tobacco. Then there's intrinsic, which is stress-induced. There's drug-induced from NSAIDs, sodium bisulfites, and epinephrine, and metabisulfite. Exercise-induced, which is due to thermal changes in the lungs. And then the last one is infectious type that results from an infection in the respiratory tract. The signs and symptoms of an asthmatic attack can be classified into mild, moderate, and severe. For a mild asthmatic attack, respirations are difficult and slightly faster than normal, with a mild cough, wheezing, tightness, and shortness of breath, with no changes in skin color, and complete sentences can be spoken. During a moderate asthmatic attack, respirations are moderately difficult, they're faster than normal range, and only phrases or partial sentences can be spoken. Moderate complaints of wheezing, a cough, shortness of breath, or tightness in the chest. And the skin color will change to normal to pale. Slightly moderate drawing in of the muscles between the ribs to facilitate breathing. Now, during a severe asthmatic attack, respiration is labored, and it's very either fast or slow with a lot of distress. Only single words or short sentences are spoken. Severe complaints of wheezing, cough, shortness of breath, or tightness in the chest. And the skin color will be poor. With this, level of awareness is decreased. Prevention of an asthmatic attack is possible by limiting exposure to allergens and triggers, and also the patient should be asked to use their bronchodilator prior to their appointment if needed. During treatment, the bronchodilator should be accessible to the clinician and kept in close range. For the treatment of an asthmatic attack, first you want to recognize the signs and symptoms, which is coughing, wheezing, chest tightness, and shortness of breath. You want to terminate treatment. Position the patient upright with arms forward to allow more air to enter the lungs. Tight clothing should be loosened to facilitate breathing. The patient should be given their personal bronchodilator for self-administration and instructed to inhale and exhale through pursed lips. If the patient does not have their inhaler, a standard emergency kit inhaler containing albuterol can be administered. The recommended first dose is 2 puffs. And supplemental oxygen can be administered at 4 to 6 liters per minute using a non-rebreather bag while monitoring vital signs. If the asthma attack does not subside, call EMS.